Hi there, and welcome to the lecture on Chapter 12, the Male Reproductive System, or Male Reproductive Medicine. Reproduction, if you break down the word using the word parts, actually means to produce again and again. And that is what the male reproductive system and the female reproductive system truly does. It produces, in the case of the males, you're producing sperm again and again, producing sperm in order to procreate, to produce more people, or more offspring. So before I launch into the lecture, of course, I promise you 2 word of the days or term of the days. The first one, I have to give credit to a previous student, though I can't remember which previous student it was, who used this as her word of the day for her assignment. Diphalia was the word of the day. Literally means phallo, like phallic or phallus, means penis. Di meaning 2, and ea, a condition of 2 penises. And I just thought that was hysterical, so I had to look it up and see, really, is for real that happens? So apparently it's a very, very rare disorder, maybe 100 cases ever recorded. And it's more like Siamese twins. The mechanism of the disorder is more like it's Siamese twins, and the second twin doesn't develop all the way and happens to fuse and develop in the genital area. So here's a picture of, I think he was famous like circus performer in like the freak show tent, the freak tents, and he had 3 legs, he had a 3rd leg, and he had 2 penises. Apparently both were fully functional. So diphalia also is called penile duplication. I'm not sure there's like a man who just has 2 penises. I think usually there's other legs or other appendages or things involved as well. But because again, I think it's a condition it's more like having a Siamese twin just in the genital area. The 2 fertilized eggs fuse during development and develop improperly. P.S. There's also a similar female condition, same thing with 2 vaginas. My other word of the day is baculum. Baculum is a penis bone. Humans don't have penis bones. I learned this. I don't know where I heard this, and I thought I had no idea that certain animals had a penis bone. But now I do, and now you all know too, that in fact most mammals have a penis bone. It's called a baculum, and the Latin root of the word actually means staff or walking stick. All right, and here's a list of some mammals that do have bacula, plural, okay? Dogs, cats, your household pets all have penis bones, bacula. But humans do not, elephants do not, horses, rabbits, whales, all of us, we are in the group of mammals that do not have a penis bone or a baculum. And I threw this picture in here because I used to be a huge fan of the TV show Quantum Leap. I think it was like on the Sci-Fi Channel. And it's about this guy, and he like can travel through time, and he like leaps into people's bodies, and he can change history by, controlling their bodies so that then the outcome of a certain event changes. I don't know, it was like a time travel show, and I liked it. But anyway, the actor, his name is Scott Bakula, which I think is funny. It's spelled differently, but his name means penis bone. So those are my terms of the day. So I also like to preface this lecture a little bit, in case it isn't already evident, that I tend to take a very informal, sort of jokey stance when talking about the reproductive system, because I have the sense of humor of a 14-year-old boy and I guess the same level of maturity. Now, if you are going into the field of allied health, if you're going into an allied health profession, which I assume most of you are, this is a topic that should always be discussed with extreme professionalism. But for the purposes of a class, I like to think that humor helps you learn and helps you remember. So I have given in to my immature sense of humor as a learning tool, okay? Not meant to be disrespectful, and not meant to be used in a professional setting in a hospital or healthcare situation. But in the class, I find it makes things more entertaining, and it makes it actually easier to retain. So please don't feel disrespected if I make some jokes or if I giggle when I'm talking about penises. Okay, and don't feel guilty if you giggle a little bit. So this is a diagram of the male reproductive system, both the external and internal male genitalia. So the external genitalia include the penis, also the testicles, the scrotum, which is the sort of sac of skin that contains the testicles, and the epididymis. These are all parts of the external genitalia, because if you sort of see where my little cursor hand is circling, this is all outside of the peritoneum. It's outside of the internal cavity of the body. So these are all parts that are external. The internal genitalia include the prostate, part of the urethra, part of the vas deferens, and the seminal vesicles. All of these glands here, the bulbourethral gland, the prostate gland, these are all internal organs of the male reproductive tract. So in the next couple of slides, I'm going to go through a lot of these different parts in more detail, but just to call your attention to some of the general layout and some other terms that we won't necessarily go over in more detail. This patch of skin here between the testicles, between the scrotum and the anus, is referred to as the perineum. I do think I have a slide on this later, because I like to remind people that the perineum is different from the peritoneum. The peritoneum, which is the sort of membrane that lines the abdominal cavity, and that sort of abdominal cavity is the peritoneum. The perineum is this patch of skin between the testicles, or the scrotum, and the anus. And I think maybe I have that reminder slide in the next lecture on gynecology, because females also have a perineum. What else should I call attention to? Nope, everything else I will go over as we go. So, the scrotum. The scrotum is this sac of skin here that contains the testes. The testes are where sperm is made. Sperm are made in testes, plural. Testis is singular. There's usually two of them. Males usually have two of them. And they are part of the external genitalia because they actually need to be a little bit cooler than body temperature. It's important for proper sperm development. And in fact, males involuntarily can retract. Like for instance, when they're very, very cold, testicles actually retract a little bit to get closer to the body so that they can warm up, because it's important for proper sperm development. Also why men are not supposed to spend a lot of time in hot tubs, because the heat, the temperature, can actually cause infertility if you do it a lot. The testes are also referred to as the gonads. The gonads in males and females are the sex glands, the glands that produce the sperm and the egg. So in the males, testes are the gonads are the testes. In females, the gonads are the ovaries. The testes are also somewhat special because they are part of the reproductive system, but they are also part of the endocrine system because they secrete a hormone. They secrete testosterone. So they make sperm, they also secrete testosterone. So there's a couple of combining forms for testicles, which I think is interesting, and so I have a whole slide on it. So testiculo is the Latin combining form, because testes testis is Latin for witness. So in modern day and age, you go to court and you're a witness, you get called up as a witness. What do? You have to swear on the Bible. You put one hand on the Bible and one hand, and you swear to God that you are telling the truth, the whole truth, and nothing but the truth. Well, back in Roman culture, in the Roman court, men had to swear on their testicles instead of the Bible. They actually had to put a hand on their testicles and swear by their testicles that they were telling the truth or whatever. So that's where the combining form testiculo comes from. It actually means witness. Orchio is a combining form, is the Greek combining form, meaning testicles, or referring to the testicles, and it comes from the word orchid, because Greek scholars thought that the testes resembled an orchid plant. Now, I don't know about orchids that you've seen, but the ones I am familiar with are like the Asian orchids. They're like purple or white, and they're kind of like, they're very flowery, and I don't think they look anything like testicles. So I was always a little bit confused about what ancient orchid looked like a testicle. And a couple semesters ago, like right before I gave this lecture, or maybe it was right after I gave this lecture, I went for a hike with my husband. We went camping, actually, in I don't even remember where we went, what mountain it was, but it was over down by the Adirondack Lodge. You know, you go down Adirondack Lodge Road, there's a bunch of high peaks there, and there's the Adirondack Lodge, which is like where you can sign in, and there's like a gift shop. And we walked in there. We went in there to go to the bathroom when we got back from our camping trip. And there's a poster on the wall that talks about all the local flora in the area, like different flowers and things that you might see in the Adirondacks depending on the season. And lo and behold, there's a picture of this guy. Pink lady slipper. I took one look at it and I was like, oh, ho, ho. And I took a picture of it so I could put it in my lecture, because that is a flower that looks like that is an orchid that looks like a testicle to me. And I looked it up too. It is in the orchid family. So this must have been, or some relative of this orchid must have been, what the Greeks were thinking of when they used the combining form orchio. All right. So that's a little etymology for you. So on top of the testicles sits the epididymis, which is actually like a really long coiled tube that's just coiled really and packed really tightly. So the sperm are made in the seminiferous tubules of the testicle. So here's a close-up of the testis, and there's all these little tubules within the testis, all right? And here's a zoom in of that. And within the seminiferous tubule of the testis, the sperm are made and mature, and then enter this tubule where they can travel then to the epididymis. Within the epididymis, the sperm gets sort of its final dressings, okay? It gets finished up, and it gets capped. So all sperm have, they consist of a head region and a tail region. And the head region is where all of the genetic information is stored. The tail is really just a whip to help them swim into the eggs once they're, inserted in a female. And this head, this has a cap on it. The cap is added in the epididymis, and it has like enzymes and stuff in it that actually help protect the sperm from the acidic environment in the vagina. Also helps to penetrate, has enzymes that help activate and penetrate the egg once it reaches there. So also in the epididymis, defective sperm get eliminated. So there's a little bit of a, filtering process that goes on in the epididymis. So epididymis, the etymology of this word, actually didymo, di, meaning two. Dymo, I guess, means structure. So didymo means twin structures. There's two twin testicles, so didymo means testis, and epi means upon. The epididymis is upon the testis. Look at that. So here's sort of a full shot of just the male reproductive organs, so we can sort of walk through the path that sperm takes. So here we are in the seminiferous tubule. Sperm, like stem cells, develop into mature spermatozoans. So spermatocytes are immature sperm cells, and a spermatozoan is a mature sperm. All right. So a healthy mature sperm goes into the epididymis, gets capped, then travels through the epididymis through the vas deferens, which is this long tubule here that attaches the epididymis. goes up and around the bladder and attaches to the seminal vesicle here, which is sort of a storage spot for sperm. Also, it is a place where semen or seminal fluid is produced, which is most of the volume of semen is actually the fluid portion, whereas the sperm are sort of just mixed in there. Then the vas deferens, after the seminal vesicle, there's a little duct called the ejaculatory duct, which is where the reproductive system fuses with the urethra. All right, and then the sperm can travel through the urethra, through the penis, out through the urethral meatus during ejaculation. So this vas def, the only other etymology I want to point out here was that vas deferens means vessel to carry away. Vas means vessel. It can mean blood vessel, or it could mean vas deferens, vessel. And here, right here, I wanted to point out the bulbourethral gland is also a sexual gland that produces some mucus and fluid that also gets mixed in to the ejaculate, to the semen. Semen is like the combination of seminal fluid and mucus secretions and prostatic secretions, as well as the sperm itself. And I think I'm talking about the penis on the next slide. Here we go. So the tissues of the penis. So remember, we don't have, as humans, we don't have bacula, we don't have a penis bone. The way that humans achieve an erection is through vasodilation, actually blood flow, and tissues that fill with blood. So the erectile tissues that surround the penis are the corpora cavernosa, which are these two like pieces of tissue on the sides, and the corpus spongiosum, which is the one that runs down the posterior portion here. Okay? Or I guess this is the ventral portion. The ventral portion, because anatomical position is actually with the penis erect. So this would be the ventral portion of the penis. So I have this little Harry Potter wand here because I love Harry Potter, and these words, corpora cavernosa, they're very Latin and they make me think of a Harry Potter spell, and then that makes me laugh because I think of that a wand is very phallic, and that I think of, you know, male erections sometimes. So all you have to do is like you wave a wand and it goes right up. So corpora cavernosa, it's kind of magical, you know, it's kind of magical. The blood just rushes in and it just lifts on its own, okay? Corpora cavernosa and corpus spongiosum, those are the two erectile tissues in the penis. The head of the penis is called the glans penis. In fact, there's some interesting etymology to that as well. Glans actually is Greek or Latin for acorn, or actually no, I guess it's not. I don't know. I don't actually know what glans means, but both the Greeks and the Latins thought that that the tip of the penis looked like an acorn. Now, I'm not sure if they thought it looked like the cap of the acorn or this part of the acorn, but you know, there's a picture of an acorn for you for your own creative inferences. So I guess both of these terms, glans penis and balano, which is the Greek root, I guess, mean acorn. So the glans penis is this tip of the penis here. Balano is actually a combining form just for penis. Like we'll talk about balanitis is the term for infection or inflammation of the penis. So this, it looks to me like kind of like a picture of a circumcised penis. But an uncircumcised penis has an extra foreskin. The foreskin of the penis, the medical term for foreskin is actually prepuce. The proper pronunciation there is prepuce. And so an uncircumcised penis looks like this. There's the extra foreskin. The foreskin sort of hangs past the glans penis, at least when it's flaccid. And the circumcision sort of cuts around, circum, like circumference, all right, incision, like an incision. Okay, circumcision cuts around the prepuce or the foreskin and removes the tip of it. so that then a circumcised penis, you can see the glans penis. The foreskin is removed. Okay? So a little bit of physiology about the production of sperm and then all the way to ejaculation. Spermatogenesis is the medical term for the production of sperm. And it starts at the onset of puberty in males. So males do not produce sperm before they hit puberty. Spermatogenesis starts in response to the production of a couple of hormones that begin at puberty. These hormones are produced by the pituitary gland, follicle-stimulating hormone, also known as FSH, and luteinizing hormone, or LH. These are also the same hormones that stimulate puberty and pubertal development in females as well. So in males, this follicle-stimulating hormone is what stimulates sperm production. It stimulates those spermatocytes, those little immature sperm cells, to begin dividing and developing and maturing into spermatozoa. Luteinizing hormone stimulates hormone production by the testes, by the gonads. So it stimulates certain cells, which are called the interstitial cells in the testes, to start secreting testosterone. That testosterone then has a whole bunch of other effects in sexually maturing that individual. So there are a lot of different characteristics that testosterone causes to develop. Testosterone will cause hair development, pubic hair development, face, chest, pubic region, underarms, okay? Testosterone also results in the deepening of the voice. It cycles back to the testes and enhances sperm production. And it also affects sex drive and moods, etc. So a sexually mature male can achieve an erection through various ways, through physical stimulation or even just through thoughts that encourage arousal. And again, we don't have a penis bone, so the human erection is just due to blood flow, increased blood flow into the erectile tissues, the corpora cavernosa and the corpus spongiosum. And they start to swell, which causes the penis to lengthen and stand up and become swollen and hard. And if the penis is then stimulated, it results in ejaculation, which is basically contractions at the base of the penis that result in release of semen and seminal fluid and sperm from the seminal vesicle into the urethra that mixes with stuff from the bulbourethral gland and travels through the urethra and out the urethral meatus. So ejaculato, the combining form ejaculato, literally means to expel suddenly. So an ejaculation is to expel suddenly semen and all of its contents. I thought I had something else to say there. So that is the basic physiology of the male reproductive system. Some diseases and conditions that can affect male reproduction. Cryptorchidism or Cryptorchidism, or the easier way to say it is Cryptorchidism. Cryptorchidism literally translates to a disease or condition from hidden testes. Okay? And this has to do with the way that the testes actually develop in utero during development, during fetal development. So originally, as the gonads are developing, and here we have a 5-month-old fetus, okay, the testes have sort of developed within the peritoneal cavity, but now they need to descend, they need to drop. So they take this actually fairly long time to do this. They actually have to push through the inguinal canal here. They actually make a hole through the abdominal muscles and descend, here it's better to see here, and descend through this inguinal canal, the groin canal. And that is the proper position of them. So if they are not dropped. They are hidden. All right, so they're still up here somewhere if you are born with cryptorchism. And doctors can fix this through a surgery called orchiopexy, where they actually manually take the testes, pull them down, and fix them in place, an orchiopexy. There are some conditions that affect fertility. So a varicocele is essentially like a varicose vein in the penis that can block the urethra and can cause infertility in that way, trouble ejaculating, I suppose. Infertility is just the term for not being fertile, not being able to produce, not being able to reproduce. Now, there's a lot of different types of infertility. There's a lot of different types of male infertility. You could be not producing any sperm. You could be producing very few sperm, which would be oligospermia. If you're producing no sperm, it would be aspermia. You could be producing plenty of sperm, but they're just not very healthy. They're not moving very much. And that can cause infertility. So here's a picture of sperm counts using a hemocytometer. So like a, system of squares. So all these little light, dots that look like little lights, those are sperm. You can see their little tails. Someone, I guess, a normal sperm count versus someone who has very few sperm on their slides. That would be oligospermia. A lot of different types of inflammation affecting the male reproductive system. Epididymitis, inflammation of the epididymis. Orchitis, prostatitis, balanitis, all right, inflammation of the testicles, prostate, or penis from various different types of infections, usually. Testicular cancer, actually I think it's one of the more common cancers out there. And also cancer of the prostate gland are two types of cancers that affect the male reproductive system. Some other types of growths, I guess abnormal growths that are not cancer per se. Benign prostatic hypertrophy, or BPH, is what it says it is. It's benign, so it's not cancerous. Hypertrophy, excessive or more than normal development, and prostate, of the prostate. So it's not cancerous, but if the prostate is very swollen, if you have this hypertrophy, you have excess growth of the prostate. And if you remember, the urethra goes right through the center of the prostate. So if the prostate is growing excessively and swelling, it can squeeze on that urethra and cause it to be very difficult to urinate, painful urination. It can be painful. But it can be surgically fixed, and I'll show you that procedure in a couple of slides. Gynecomastia is a condition where males develop female-like breasts, so their breasts develop, large. So, and that is, I think, due to hormone imbalance, and also can be surgically augmented. Diseases and conditions of penile erection, one that most people know about because there's commercials on TV for it all the time, is erectile dysfunction, which can be physical or it can be psychological, and a lot of times I think it is psychological. But it is difficulty getting or maintaining an erection and can lead to impotence and inability to, again, and infertility. And there are drugs for that. There's Viagra is the one that's most common, and I think there's now generic versions of Viagra as well. And essentially, Viagra can help you to get blood to the penis for an erection. It's a vasodilator. One of the unfortunate side effects of Viagra, especially if you are healthy and maybe and young, is priapism, because there's a sort of, I guess, a move. I don't know what you call it. There are people who use Viagra recreationally who do not have erectile dysfunction and use it recreationally, and I think in particularly among that population, a very undesirable but yet common side effect is this, priapism. Priapism is an extremely prolonged erection that can actually be very painful and can be a side effect of taking Viagra, and can, I guess, happen to people normally anyways. Chordee is a curvature of the penis when it's erect and is usually associated with hypospadias. Remember, when the urethral meatus is positioned on the bottom side of the penis. So if you have hypospadias, oftentimes you also, when you have an erection, your penis is curved and is curved sort of downwards. Premature ejaculation is another condition, I suppose, of the penis. So ejaculating before, I guess, before the penis. Technically, I would think that premature ejaculation would be before the penis is actually in the vagina, where it can then initiate fertilization. So premature ejaculation would be unable to fertilize because you can't make it that long. Some people define it differently. I guess premature ejaculation could be ejaculating before you want to, before you are ready, before your partner is ready. Dyspareunia is a term that means painful, a condition of painful or abnormal intercourse. So this can be if you have some kind of infection, like a sexually transmitted infection, that causes sex to be painful. Another term is postcoital pain, so pain after sex. So I guess that's a different term. Dyspareunia would be pain during sex. Postcoital pain would be pain after sex. Could just be from soreness, but both could also just be from, and it could be from an infection or some other condition of the penis or vagina in the case of females. There are a number of sexually transmitted diseases. Now I think they're actually, the term now is sexually transmitted infection, STI, as opposed to STD. Another word for that is venereal disease, so VD, STI, STD, they're all synonymous. And I'd just like to point out here, call your attention to the fact that there are 3 different combining forms for the term for sexual intercourse. Peruno, as in dyspareunia. Peruno means sexual intercourse. Coito, as in postcoital pain, or coitus, right, sexual intercourse. And venereo. Venereo coming from the goddess Venus, which I have her pictured back here. The goddess of love was Venus. So that is also a combining form for sexual intercourse. So a bunch of different sexually transmitted infections, not all that exist, but some of the more common ones. Well, really this should be HIV, human immunodeficiency virus, which causes, it can lead to AIDS, acquired immunodeficiency syndrome. It's a virus that infects your white blood cells and sort of debilitates your immune system. Chlamydia is another infection. It's actually the most common sexually transmitted infection out there. Genital herpes, HSV1 and HSV2, both can cause genital warts, and they kind of stick with you for life. Herpes viruses have that ability to go dormant inside your cells and then reappear sort of later on in life. So genital herpes, you can have active herpes or you can have dormant herpes infections. Also increasing in number and affects actually a large amount of people. HPV, human papillomavirus, I would actually think is probably more common than chlamydia, but doesn't always cause disease, so maybe it's not considered in this statistic. But I think like 80% of sexually active people are infected with HPV at some point during their sexual lives. But not necessarily, they don't necessarily have the strain that causes warts. So HPV, there's like 60 different strains of HPV. Some cause genital warts, which are called condylomata acuminata. And I didn't put the picture in the lecture. I think there's one in the book. It's kind of gross if you look them up. They're not like the warts that you get like on your hands. They look very different and very obvious. There are some strains of HPV that, not the ones that cause warts, but there's different strains of HPV that cause cervical cancer, or can cause cervical cancer. And in fact, when ladies get pap smears done, it is to check for the presence of abnormal cells due to HPV infection. The list goes on. Gonorrhea, syphilis, and trichomoniasis are all bacterial infections that are sexually transmitted. And that's all I really want to talk about with those. A condition of the foreskin or the prepuce is phimosis. Phimosis is if you're born with a foreskin that closes too tightly, so that when the penis becomes erect, it can't stick out of the foreskin. The foreskin kind of traps the penis in. So the treatment for that is circumcision. In fact, a lot of male babies get circumcised anyway, whether or not they have phimosis. So it was once thought to be more hygienic. I'm not sure that I think the jury might be out on that a little bit, whether having a foreskin or a prepuce is more or less hygienic. I think most hospitals ask you now if you would like to do that to your male child. Some surgical procedures, biopsy. I feel like I repeat this every lecture. It's repeated in every chapter. Anytime you're taking a tissue sample, a live tissue sample, to look at the cells under a microscope. Circumcision, the process of cutting around the foreskin to remove it. An orchiectomy, orchio being testicles or testes, ectomy, removal of. So, for instance, in the case of testicular cancer, you might have to have an orchiectomy. An orchiopexy is a process of fixing the testicles in place. This, and I should do this motion because it's usually to pull them down, not to pull them up. In the case of cryptorchidism, a failure of the testicles to descend during development. Another one that makes the men in the class wince, because again it involves sticking a probe down through the urethra, through the penis. This would be a transurethral resection of the prostate in this picture here, or TURP. This is for conditions of the prostate. So if you have prostate cancer and the prostate, maybe the tumor is really bad, you might have to have a prostatectomy. You might have to have the prostate removed. You might be able to have it removed transurethral. But another procedure that's transurethral is this resection of the prostate, particularly for that BPH, for benign prostatic hypertrophy. So you have this prostate that's swollen and hypertrophic. I think I made that word up. And you can see it's squishing, it's sort of squeezing that urethra closed, and it makes it hard to urinate. So the transurethral resection uses this tool to sort of shave away the sides of the prostate and the urethra so that it widens that opening, and then you can urinate again. And the last procedures that we'll talk about for this chapter are vasectomy and vasovasostomy. So a vasectomy is literally, that stands for surgical removal of part of the vas deferens. And now I want to go back to that slide on the vas deferens. So the vas deferens, remember, is this long tube. Here we go. This long tube or cord that connects the epididymis from the testis and carries it to the seminal vesicle. Okay, so a vasectomy cuts out a small section of this. Some doctors might cut out a larger section, but what you're supposed to do is cut out a small section of that vas deferens, and then they cauterize the ends, so they sort of seal them off, so that sperm are still being produced by the testes, and then they travel up, and then they kind of come to a dead end. So then when the other issue sort of there is men with a vasectomy, they still produce semen. They still produce an ejaculate, because most of semen, remember, is seminal fluid from the seminal vesicle here that still is connected to the urethra. So essentially, and a lot of men who have vasectomies, the consistency of their Ejaculate changes a little bit, but they still are ejaculating usually the same amount of fluid. The sperm are just really a small portion of what gets ejaculated. So a vasectomy, you still can ejaculate, you still ejaculate semen, fluid, it's just devoid of sperm. Now, a vasovasostomy, and I feel comfortable sharing some personal information with you. My husband actually was married before we were married, and he has 2 children. And after those 2 children, he had a vasectomy. And I wanted to have babies, and clearly I am having a baby. So he had to have a vasovasostomy, which is essentially a vasectomy reversal. He had to have those 2 snipped ends of his vas deferens cut open and then sewed back together. And we used a very skilled doctor, was very successful, clearly. So if anyone needs his number, let me know. But my husband does like me to pass on that it was not a pleasant procedure. How does he describe it? He described it as having your balls slammed between 2 bricks, then lit on fire, and then stuck into an angry bee's nest, is how he describes it. Though all the other testimonials said that it was a painless procedure, that the anesthetic worked wonders. So, reverse at your own risk. But anyway, vasectomy is snipping out a small part of the vas deferens. Vasovasostomy is taking the 2 vas deferens, so that's where the vaso comes in, the 2 ends of the vas deferens, and stomy, creating a hole, creating an opening between them, or it should really be a vasastomosis. That's what I would call it, because it's putting together sort of 2 tubes, and in other parts of the body with the vessels or with your intestines, it's always an anastomosis. So I would say that a vasovasostomy is a form of anastomosis, sticking back together 2 tubes. But that's the chapter 12, the male reproductive system. So your next test is going to be on chapters 11 and 12, the urogenital system. Both I feel are sort of shorter chapters, and there's a bit of overlap because those parts of the anatomy do overlap. And so hopefully you guys will all do very well on this next upcoming test, chapter 12. Almost there, almost to the end, and I'm signing off now. Bye.